Hi Tyler, how are you?
Doing great, thank you.
Okay, for those who don't know Tyler, I'm gonna be very brief on his introduction. He's basically worldwide known among the climbing community for both his performance-oriented training programs and rehab protocols when dealing with climbing injuries. So thanks a lot, Tyler, for being here.
Oh yeah, you're welcome. Pleasure to be here for sure.
Uh, as many of my YouTube subscribers and myself, I'm from Spain, so probably they don't know you. So I'm gonna be shooting some short questions. So first one will be again, as I'm Spanish and European. Next to your Instagram, and for those who don't know, your Instagram is C4HP, Come for Human Performance. Next to your name, it can be read like DC, MS, CSCS. Well, I guess there are some uni degrees. Which are they?
Yeah, those are just like secondary education things in the States. So like the DC is I went to chiropractic school out of college, out of undergrad. So I went to, it's essentially it's kind of like an osteopath, probably where you are, or kind of like physios, in different countries, there's similar things, but they have different scopes of practice. So different things they can do in terms of like diagnostics and intervention. So for my background with a doctorate, with a DC, I can pretty much do anything that any other doctor can, with the exception of prescribing like medication.
Right. Okay.
So I went to that schooling, and I never really wanted to like be a practicing chiropractor necessarily. I was interested in strength and conditioning. And so at the same time, I did a master's degree in exercise science. And so that's, that information and the physiology and the anatomy I learned from my doctorate is really what I apply most of what I do nowadays, which is manage like connective tissue and sports injuries.
Wow. Okay. Yeah, it's not exactly the same as it is well, at least in Spain. Right. So what do you do for the living then?
That's the majority of what I do nowadays. So I have a clinic in Utah where the USA climbing headquarters is in Salt Lake City or close to. Mm-hmm. And I have an office where people can come in and get tested and do diagnostic ultrasounds. And I do rehabilitation programs for those people. Okay. But now the majority of my business is doing remote consults with people over Zoom calls like this and writing programs for people around the world that have sports injuries. Right, yeah. Okay, that is great. Actually, it's super cool because I've never actually come across a person with your background, at least a fanatic one in a sector crack or at the crack. So how long have you been climbing? Because you're a climber, right? Yeah, I've been climbing since 2001. So, almost 20 years. So since I was since I was in college, I played sports my whole life, and typical like baseball, wrestling, football. Yeah. In the States. And then I went to college to play sports and did not want anything to do with it anymore. And so I ended up meeting some friends that were into, mountain biking and hiking and skiing and climbing. And then I moved to Colorado and started climbing then. Right. Awesome. And do you consider climbing like, so to say, your way of living, like your passion? Like, oh yeah, it's kind of one of those things that it becomes like just a big part of your life, right? And yeah, I've always been kind of an adventurous person, and so as it goes with any like person that likes to be outside in the mountains, eventually you end at a cliff, and eventually you have to start climbing something. Yeah, so it works very well with like my lifestyle and like being outside. And I've always kind of fallen into the minimalist kind of living basic lifestyle, that most climbers have. And so it's always been a socially very connecting thing with me for sure. Cool. Okay, so how long have you been specifically treating climbing injuries, and like have you treated many climbers? So I've been at school for 8 years now, this May. So I would say the majority of what I do in the last 2 years, 3 years is treating climbing injuries. I think just last year alone, I calculated the finger injury consults that I did for the year, and it was like over 700 or something.
Wow.
So a lot of finger injuries for sure. A lot of finger and elbow and shoulder pain is probably the majority of what I do.
Yeah. Well, that makes sense. Oh, okay. I find like the injuries strongly determine performance. That's my point of view, at least for most advanced climbers, mature athletes, and subjects with anatomical disadvantages, which are probably the majority out there. I mean, unless you are a super, strong climber climbing 9As and 9Bs. So what do you think on this matter? Like, do you agree? Are injuries important performance factor to take into account?
Yeah, for sure. And so injuries, I always think about managing injuries from a programming standpoint, from a periodization standpoint, because a lot of times, at least in the States, people will go see someone for an injury and the primary intervention will be about the location of the body part, or they'll try and apply something to help the body part get along, but they don't really address the training program, which is the most important thing in my opinion. And so generally speaking, connective tissue injuries, tendons and ligaments, there's a lot of athletes that are participating at really high levels of sport with those injuries, but they reduce their performance.
Right.
So in order to be at the tip top of your performance, you have to have more of a better understanding of programming and how you can adjust your programming over time to stay injury free, but also keep your performance high.
Right, because as you fall into, if you have an injury, then your performance automatically drops. So you have to get back again into track. So, okay, so looking at your Instagram stories, I can tell you read a whole bunch of fresh issued papers, meta-analyses. Why do you do this?
I've always just been kind of interested in kind of a less biased perspective, I guess, on a topic. I've always kind of just been interested in, I'm not really emotionally attached to many things, right? And my wife hates that, and that's a good and a bad thing, right? But I'm pretty easy to kind of just change my opinion based on what a lot of data would suggest when it comes to interventions. Like a lot of the things that I learned in graduate school, I don't do at all, because they're kind of outdated and they're kind of very 1980s kind of management for spinal pain, where the more modern versions of managing spinal pain don't look like what I learned in school. So I don't do those things at all. And so the real answer is the only way you can stay relevant in terms of understanding, how the world changes is by reading research papers, right? Because when you're at a graduate school, no one's feeding you information. Right? And hopefully they're giving you good information, but the problem with schools is they're always behind where the research is suggesting. And so you're getting fed a bunch of information, but that always needs to be kind of taken with a critical eye, and then always thinking about, there's probably something else out there. So that's part of the reason. And then I listen to a lot of specific science podcasts as well that I get information from, but it's always just it's interesting to me to see, what people continually do and challenge, and just the way that you have to do it. Unfortunately, kind of have to keep learning.
Yeah, makes sense. So, okay. Then the question would be, are there many myths or conceptions or treatments regarding injuries and training not supported by actual scientific evidence?
Are you finding, out there?
That's when it gets tricky, because having an effect with some sort of pain complaint, there's always some sort of effect, right? Even if you do the most random thing for a finger injury, it might influence someone's pain. So it's really hard to differentiate or to say to someone that what they did was not a good thing or not useful, because pain is all upstairs. It's all psychological. It's all, psychosocial things. And so it's really easy to influence. So it's hard to really say that things don't work or work. when it comes to like the more robust science, when it comes to musculoskeletal injuries or sports injuries, we know that loading is a good thing. And we know that loading, if we change the way we do the loading, is still safe and still, for the most part, should be considered safe, even with what seem to be really bad injuries for the general public, like a 50% rotator cuff tear. A lot of times a surgeon will say that's still rehab, but that's like strength training, loading stuff. So, you know, I tend to be like a little bit more critical through my Instagram channel about things that I think are not worth people's money.
Yeah.
You know, but it doesn't mean that they're not effective in some way. It's just like not in a way that's long-term very meaningful, in my opinion. Okay. Along with the previous question, definitely you're up to date in whatever knowledge there is regarding your line of expertise. And I'm going to take advantage of this and ask you a few questions about injuries. Let's imagine I have a serious injury on my elbow or my fingers. Let's say it's painful, so I can no longer climb. And let's say it's a tendinopathy, so I screw up somehow my tendon to a certain extent. And okay, so in this scenario, what do you think about non-steroidal anti-inflammatory drugs like ibuprofen and resting for 2 months? That would be some of the things that some climber would think about. What do you think? It would be useful? So when it comes to those types of injuries, you want to think, that's when thinking about programming is really meaningful. You know, you want to, in that case, you want to dig in the past of that athlete and see what they've been doing for the last 3 months, 2 months. That's the real reason that their whatever body part is probably become, you know, symptomatic, right? And so because that happens over a long period of time, it's going to take a decent amount of time for the tissue to go back to its, let's say, its optimal state, or its, you know, less sensitive state where the individual gets their power back. If you take an athlete that has a static or a fitness level and you drop that fitness level by having them do nothing for 2 months, that reduces their ability to get back to their sport. So it actually extends the time that it takes them to get back to their normal sport. So not loading, for the most part, with few exceptions, is not the right approach. It doesn't really work very well. And that type of underloading will make their tissue really stiff. And so it might be helpful at reducing pain or symptoms, but that's only one component of the problem, right? Where ultimately the tissue needs to maintain its tolerance for loading so they can eventually get back to their sport. And I find that people get back to their sport more quickly if they keep loading in some way. There's always a safe way to load, but they have to change the way that they're loading, or they're going to set themselves back too long. When it comes to the ibuprofen is fine for pain, but it's maybe slightly counterproductive if used for too long of a time for like the inflammatory process. Like the tendon has an inflammatory process for a reason. If we try to blunt that for too long, maybe we're going to inhibit that process. That doesn't really make a lot of sense either. But if they're really painful, and sometimes we need to take away that pain so they can actually physically do stuff, then it can be helpful. So it's never like a right or wrong. It's kind of like, it really depends on the person and the timing and the strength and their training history. Like it's not simple, really.
Yeah. Well, it makes sense. Okay, so right. So normally, at least in Spain, when you get hurt, you walk into a physio, and there you get treated with different therapies depending on the physio. Sometimes it's ultrasound therapies, other times are dry needling, percutaneous electrolysis therapy. I don't know if you get this in the US, EPTE, or diathermy or magnetic therapies. Okay, a mixture of them, depends sometimes. Okay. What do you think about this? Am I going to be ready to go climbing after getting these treatments straight away, or do I need something else?
So based on like maybe the previous injury that you had, chronic elbow pain over a couple, weeks or months of time, we can say that those, and it's not that those aren't effective, they're just not effective in the way that maybe we think that they are when we have less pain. So there's this, more like there's this disconnect between the amount of pain that someone has and the amount of tissue injury that literally they have. And so we can say that pain is not a very good indicator in one day as to what's going on with the tissue. Mm-hmm. And so if someone goes into a therapist's office and they walk out and they have less pain, in their mind, they attribute that to, something physically happened inside my tissue. That's why it feels better. The science does not really support that is a thing, other than it influences their perception of what's going on with their body part. Right? Because if it took months to develop a tendon injury, how the hell is it going to go away in 30 minutes? It doesn't make any sense, right? And so we can use those, that doesn't mean that going to the therapist is not a good idea. It means that the primary objective of the therapist is to educate the patient about what we're talking about, give them things to do that they can do on their own, and provide some sort of progression of those things, right? And it needs to be done by the patient, though. The central nervous system is in control of so many things. I can't do it for you, and you can't do it for me. The individual has to be accountable, and they have to do it on their own. And so that's one of the reasons that I actually really like my work being remote, because people expect to learn and they expect to do it on their own. And that's what the science would say is the most useful way to manage pain complaints, especially for athletes. Yeah. With few exceptions. Certainly there's some reasons where with dramatic injuries, then maybe you need some more, attentive care. But still, there's so much you can do just on your own that really requires some education, some videos, and that usually works pretty well.
Yeah. Okay, according to your experience and knowledge, as briefly as possible, which should be the steps to take in order to fully recover from an injury, that is getting back to the best performance shape with a lesser chance of getting injured again in the same manner?
So with getting injured in the same way, or not getting injured?
Yeah, right. Not getting. So
not getting injured. Okay. So I would say the most common reason that athletes get injured in their sport is a lot of volume of their sport. Right. And so what I like to think about with athletes and the progression is it needs to be something that's very strength focused, but then it slides down this continuum where the force gets lower, but the speed of the movement gets higher. So that's essentially the difference between strength and power, where the athlete needs to start with the strength stuff, which is very similar to rehab, and they need to slide themselves down that scale over a period of months, right? Maybe, and it depends on the athlete. If it's someone that's really well trained, they could slide down that scale faster. If it's someone that has a really bad tendon injury and they are not that comfortable or competent with the loading, they're going to move much slower, right? So it's very relative to the individual. But ultimately, what I see as being the most useful is people sliding down that scale at their own pace, but along the way, they're learning as to why the hell they're doing what they're doing in the first place. Okay. Right? So it's less about prescriptions and it's more about understanding the principles of why this is different than this and why someone would spend time in the middle. Because if I go from here to here, there's more pieces that you want to connect together. So I like the idea of athletes, learning about programming while they're doing it. So they know that they can kind of go back and do the same thing. But I would say the number one thing that people need to be more attentive to is not trying to extend their performance phase for too long, which everyone does. And, as soon as you feel really strong and as soon as you're as strong as you've ever been, that's when you're more likely to get injured.
Right. Yeah, it's nobody, I think.
Which sucks. That sucks because everyone wants to climb more and everyone wants to climb harder. But as soon as you're really, really fit, what you want to do is you're going to climb more. But climbing volume is more risky, right? And so, that doesn't mean that we can't push it ourselves and we can't push into that, because we can, but there's a limit to how much we can tolerate. And we have to know that at some point we got to stop, and we got to like go back to something that's different style of loading, so we don't get into the same problem that we had before.
Right. Awesome. Thanks for the advice. Okay. Okay. I understand then that well-programmed rehab plus programmed loading, so to say, or getting back into sport is key to recover fully from an injury. Okay, so the question now is, so whoever that carries this rehab, if specific training and exposure is to be expected, my guess is that it should be the most desirable that for the rehabilitator to be a climber. What do you think about this? That was one of my thoughts, you know?
Yeah, I post about that quite a bit. To me, it makes total sense, because I can understand the things that climbers do to their fingers, right? Like, if you're not someone that trains their fingers or has spent time climbing like a rock climber, how in the hell are you supposed to know how much stress your fingers can really tolerate? Right. And so a general healthcare provider that manages just the general public, they have no idea what climbers do to their fingers. Right. And so I would say it's not that they're not knowledgeable, or it's not that they can't provide useful advice. Most of the experience that I've had as consulting with people that have seen general healthcare providers, and they just tell them to stop loading, which is a terrible idea. Or they tell them to do these exercises that are way too low of an intensity to really make any sort of meaningful change. Like, you and I know climbers just in general, their upper bodies are really strong, just kind of as a baseline, much stronger than just like the general public, right? So if I take a climber and I give them advice for the general public, that doesn't keep their connective tissue capacity or their fitness level very high, which we already talked about, which will extend the time that it takes them to actually get back to their normal sports participation. So it's definitely not that, people that are not climbers can't give good advice and they're not knowledgeable about sports injuries, but it's just not as meaningful, because you can't really understand all the nuance with the sport unless you're participating in it. And I usually tell people, I know a ton about anatomy and physiology, of the shoulder, right? But I don't really treat gymnasts, right? I feel like I could maybe give some suggestions, but it's not something I do all day. I know what a gymnast does, but I don't know what their training looks like. So I can't really give them as meaningful as an opinion as I could with someone that's a rock climber, because describe to me what you do. I know exactly what that's like. I've done a lot of that, right? But so it's a little bit harder to connect with people, I think, if you're not participating in their sport.
Actually, you said something once in one of our meetings, like when you are climbing and you have your bolt 2 meters below your feet, hell, you squeeze the holds like you're mad, Sometimes when you're trying to send some route on site, you would do punch. I mean, obviously you have to be a climber to understand this. Otherwise, how would you suppose to get the feeling of this?
Right. And if you use if I take my in-laws and I show them who are not climbers, and I show them the holds that climbers hang on their fingers, it looks like the most dangerous, ridiculous thing ever, right? But for a climber, it's all relative. It's it's not really that hard. It's pretty common, right? So there's just such a big disconnect, right? And so unfortunately, that tends to give people advice that makes their injuries seem more structurally problematic than they really are. So if you go see a healthcare provider that doesn't understand the way that you load your fingers, and they say, "Ooh, this is a pulley tear. This looks bad. You should probably stop loading your fingers." What the patient hears is, "Oh my God, my fingers are really hurt. I should stop loading my fingers." Right? But if you really understand the research on finger injuries and how strong they are, it's probably not that big of a deal, right? Climbers have been climbing through finger pain for a long time, really bad finger pain too, which is pretty well documented, right? That's not the best idea either, but we can say that you're still okay to load. You just have to really be selective with how you do it.
Right. Okay. Okay. I think most of the time injured climbers are aware of this, and not knowing any climbing rehabilitators, we tend to carry this transition from injured to full performance on our own. Right? You don't know anybody, a rehabilitator doesn't climb, so you're like sort of, oh man. So which would you say are the main errors in these cases of so to say self-rehab? When you want to get back to sport, what do you find or have you seen so far?
You meaning like what can people do on their own?
Yeah, like when we self-assess ourselves and we go like, okay, I'm injured, I want to get back to climbing, and usually what do you find people do wrong when
in this transition?
Oh, yeah. Cool. So what I see that people do that's the worst in my opinion is they take away the intensity.
Right.
So the kind of the knee-jerk reaction is, ooh, my finger is sore. It must be because of the intensity or the force of the climbing that I'm doing. So I'm going to do easy climbing.
Wow.
And so when we look at the research on adults and youth climbers, climbing volume is the most risky for getting injured. And so if I take away the intensity and I do a bunch of easy climbing, now what I've done is I've opened the door to more volume.
It's funny because
make any sense.
That's what I've always done. Like,
right, and people do that.
I'm thinking, oh, this is conservative. This is conservative.
Yeah, it does not work. And people will do that for months. They'll be like, I've been doing lots of easy climbing and I'm doing more volume. And ultimately, that's maybe another, like, maybe they've been misguided by another healthcare provider that made them feel like loading with more intensity is risky. That's where, like, there's a disconnect between if the practitioner doesn't know how much load the fingers can really tolerate, they're going to educate that the client it's a bad idea to load with more intensity. But that's not the problem. It's really about the rotational stress and all of the direction changes and the velocity that becomes more problematic for getting injured as a climber. And so if we do easy terrain, now we can just do way more because it's not very hard for us. Right. And so now climbers are just exposing themselves to more finger twisting. Right. And if they have an injury to their finger, that's the worst thing to do for the finger.
Right. Thanks. That's a good piece of advice. So which do you think are the rehab tendon principles most forgotten?
Most forgotten. Probably that intensity is usually okay. Most connective tissue or most tendon research would suggest using an intensity around 75%, which is kind of like a good number to think about. And it doesn't need to be like, the exact percent, right? That's not that important. It's really that the intensity, making sure that you're getting a lot of recruitment during a rehab phase is actually a really good idea. And so that can come in a bunch of different ways, but we want the time under tension to be long. We want the intensity to be moderate, but we want the directions to be very controlled, very unidirectional.
Awesome.
And we want the frequency to be high. We want the volume to be low. And we just got to be patient and do it, right? Like, it's the thing that's kind of annoying to me about an in-person client when I had my clinic is people would come in and they would expect to be 100% by the next day, right? And you're like, it doesn't make any damn sense, right? And so the downside of having people go to healthcare providers and receive some sort of passive intervention is the individual puts too much credibility on that intervention, where that intervention is probably not that meaningful. What's really meaningful is all of the other stuff that the healthcare provider tells them. And if they tell them a bunch of things that are not supportive for their confidence or supportive for them getting back to their sport, the individual leaves thinking that their pain complaint is dramatically different or worse than someone else's. But it's probably the same damn thing. They just got really scared. And a lot of times the fear can be propagated by a healthcare provider, depending on the language that they use.
Okay. Yeah. Okay. I have prepared the following question. Maybe you have already answered, but okay, I'm gonna shoot it anyway. Okay, I'm totally convinced that we need to get taught on how to prevent injuries, and this chat with you is just being amazing, and how you're putting down some of the misconceptions we had, like about dropping the intensity and doing a lot of volume, for example. Surely one of your clinics would be super valuable beyond words. But anyways, like, could you advise just one or two valuable tips? And as I said, maybe you probably said like a few really good tips on how to address addressing typical, how to avoid injuries and addressing typical mistakes doing this. But I think you already answered. So
maybe... Yeah, well, no, we can add some more. I would say like strength training all the time for your fingers makes sense.
Okay.
And so if people can think about how a fingerboard is different than a climbing wall, they're way different. The fingerboard is way less risky than the climbing wall, right? Because the fingerboard is very controlled. It's very like in line with the design of our fingers. Mm-hmm. People are not strong enough to hurt their tendons with producing force. We're just not strong enough. The tendons are way too strong, and so are the pulleys. Mm-hmm. And so they always want to have some form of fingerboarding or slow static loading to the fingers before they climb every time. It's just like the easiest way to warm up your fingers is by doing it off the climbing wall or specifically on the climbing wall, right, before you start climbing hard. But doing a bunch of easy climbing to warm up for hard climbing makes very little sense to me. It's not enough intensity on your forearms. It's not enough time under tension to reduce stiffness to your connective tissues. That's what gets people into trouble, because that's just more climbing volume, but it's not really giving them a whole lot back, but it's costing them in the form of like being a little more risky. So I would say fingerboarding all the time is a really good idea to reduce injury risk. But the fingerboarding doesn't also have to be a big, like drawn out, Excel spreadsheet where you're adding load progressively to the stars. Like, I don't think that's necessary either. I think as long as the intensity of the fingerboarding is greater than climbing, it should be protective and should be enough of like a warm-up routine.
Nice. Awesome.
That reduces the injury risk.
Awesome piece of advice. Thanks. Right. So that's it. I think, we're done. So thanks a lot, Tyler. If you want to add anything.
That's up to you. I do enough of these where we'll, chat for hours. So I think that's fine. Whatever
awesome.
You think your clients are going to be the most help from, or your participants.
Thanks a lot, and thanks for being on this chat. So.
Oh yes, of course, my pleasure.